Okay.
So again, we locate the proximal end of the Nexplanon, and then see how you push it up here and you get this little bump. So we're going to mark that because, as you know, they move around a little bit. And that's where we want to put our anesthetic. So we just have some 2% lidocaine. No update?
No, that's
Would that be? Yeah,
yes.
it doesn't matter with or without. And of course, as soon as you put the alcohol on where you marked here, it smears, and that's okay right now because we're going to wipe it all off, but it just tells me where to go. And I can actually see when I'm putting the anesthetic in here, I can see the scar from where they put it in before, so that also tells us we're in the right place. So this stings. You remember it. I can see you bracing yourself. So what I do is I just put a little bit into start, and then I let that numbing take place before I put the rest of it. You okay? Yeah.
That's always the worst part, isn't it?
It is.
To go through it so you don't feel anything, but you got to feel that.
Yeah, right.
Okay. And then I'm just going to set this aside just in case a little bit later we wind up needing more. And then we're just going to put our Providone on here. It's our practice to do it 3 times. And this is all the same as what you would do if you were taking Nexplanon off in any traditional way. And then we have some sterile gauze here, and we wipe that off. And the reason we do that is we don't want to push the color into the incision we make. And so we just take this off, and we're ready to go. So at this point, we just, we're going to switch to sterile technique, and Susan's going to put on some sterile gloves for me, and we're going to have this up really quickly.
We already went over it.
I have a little problem with my sterile gloves. I'm not ashamed to admit it. Putting sterile gloves on, I'll get like 2 in 1. And fortunately for me, I have a medical assistant who's a surgical tech. And so the first time she saw me put on gloves, she's like, "No, Karen, I'm putting your gloves on for you." So I am not ashamed to, even with that. But anyways, and then we're going to put a fenestrated drape over here. Okay. That just fenestrated is a whole MD drape. We like to say fenestrated because then we can charge more for our procedures. Okay. Now we're just tuck this in here so hopefully it'll stay where it needs to be. Okay, so the different part of the technique starts now, and what I have here is a number 4 punch. I think as I do many more of these, I may be able to get it down to a 3 or a 2, but right now I'm using a 4. It's not real big. And what I'm going to do here is I'm going to, again, palpate the proximal end of this Nexplanon and then get it to bump up here. And this is really the most important thing, is that you take your time before you start putting that in and really palpate where it is. Now I'm going to ask Susan to put a little bit of surgical lubrication right near where I'm going in. And the reason I'm doing that is we've done the first of these. The skin is really tougher than you think it's going to be. And yeah, I can use here. This is a sterile lubricant similar to what you use on a PAP. And the reason for that is it makes the skin a little slipperier, and then when I put the punch on, it doesn't tug so much. So again, I can palpate the end here, and I have my assistant Susan just put a little bit of traction to, don't touch the lubricant or you won't have any traction. Okay, let go there.
Okay.
You know, it'd have to be on both sides so it doesn't move the next one. I may be able to just get it this way. Okay. So I'm kind of feeling here. I can feel it. You all right? I can feel the tip of it. And what I'm doing is I'm just taking this punch and very gently putting it through the skin, which again, as you know, is very taut. And then as we take that off, the Nexplanon is right there for us, and then we are going to be able to pull it out. There we go. So it's right here, and for all of those of you who have ever dug around for Nexplanon, I'll grab it, Susan. You got it?
Yep.
Okay.
Hold that.
Now, anyone who's taken one of these out, knows that this is the critical part. We've got the Nexplanon. I'm sure if you've done this, you've seen many attempts to chase the Nexplanon through subcutaneous tissue, and it's a slippery little devil. And then, and then there's always, just where it went in, a little bit of adherent tissue here that, you okay?
Mhm.
Yep. That we're just gonna carefully dissect, and then, thing pops out and we're good to go, which is what we're doing right now. But, for me, there you go. 12.
Wonderful.
So for me, it's the digging around, that's where you get all the bruises. And if you look here, what we're left with is...
Is that you? Is that?
That's me, yes. So what we're left here is just a little bit of a superficial punch wound. And we're just going to put some steri strips on that, and those heal up really nicely. Just minimal bleeding here. And there, it's out.
Cool.
Yay. Stop it.